Chapter 37, The Toddler and the Family, Sandra Monk. As far as promoting optimal growth and development with the child that is a toddler, and toddlers are considered the ages of 12 to 36 months. You've probably heard of the terrible twos, and that's true, and then sometimes they go over into the threes too. This is a time of intense exploration, high energy, temper tantrums, and kids acting obstinate, and it occurs frequent on a daily basis. As far as their biologic development, their weight gain slows to about 4 to 6 pounds a year, and their birth weight should be quadrupled by 2.5. So an 8-pound baby would weigh 32 pounds. So by the time a kid's 2 years old, then they have quadrupled and would weigh about 32 pounds. It would be tripled at 6 months, and so it kind of slows down, or tripled at 1 year, and so it does slow down just a little. Height increases to about 3 inches per year. Their chest circumference still exceeds their head, so they kind of toddle around, and if they try to run or move too quickly, they can fall over. And so that's kind of characteristic of the toddler years. The growth is step-like rather than linear also. And they can appear a little pot-bellied, and they also can have short-bowed or curved legs, which gives them their toddling gait, and that's why we call them toddlers at this age. Okay, sensory changes at this time. A visual acuity of 20/40 is acceptable. As we know, all of their systems have not completely developed. And also we need to have like strabismus evaluated this time to avoid amblyopia. So if a child has an eye that moves to one side or the other, or the gaze is off, that needs to be looked into. Hearing, smell, and touch increase in development. That's why they don't like to mix foods. That's why we don't like to mix foods. Kids sometimes like to mix foods, but anyway, so if you introduce a new food and you're introduced to new foods, then they won't know which one that they like or dislike, and so it can create a problem for kids, getting them to try new foods. And they use all their senses to explore the environment, still putting things in their mouth, still tasting things, still, sticking things, putting things into light sockets and those sort of things. And climbing and falls become a problem. Once a kid gets about 12, 14 months old, they want to climb on everything. Most kids. I'm not saying that all kids would, but high majority, boys and girls, will climb. And then most physiologic systems are relatively mature by the end of toddlerhood, which is, going on towards the 3rd year. And they can control their body temperature better now. The digestive processes are complete. They can eat 3 meals per day and be, pretty good, with that. Upper respiratory infections, ear infections, and tonsillitis are common among toddlers, and other infections are better with improved immunities that they obtain during this age. They have the voluntary control of elimination and sphincter control by age 18 to 24 months. There's not much use to try to potty train a child before age 18 months. Some kids are ready then, some are not ready till 2 years or even the 3rd year. At age 36 months, you're almost guaranteed success. Some kids are a little more stubborn than others, but and this kind of things that they want to do is watching other kids. Kids that are in child care tend to potty train real easily because of that, and kids that have older brothers and sisters tend to toilet train more easily because they've got somebody to kind of watch. So they can go to the bathroom with a parent, the same sex, to kind of see, how to potty, and that's a good way if it's the first child. There actually is a iPad app for kids for potty training to bribe them into using the potty. Other people use things like M&Ms or something else. Or again, just allowing, watching other people go, and it being something that they want to do that everyone else is. The next slide is slide 6, and we talk about locomotion. How the kids are moving along. They walk along by 12 or 13 months, still using a real wide stance. By 18 months, they try to run, but they'll usually fall down. They can walk up and down stairs at age 2, hop on 1 foot, or jump with both feet at 2.5. And when I say walk up and down the stairs, they're hanging on pretty good, or somebody's hanging on to them. Improved coordination between ages of 2 and 3. They have fine motor development is continuing to develop with improved manual dexterity between ages of 12 and 15 months. They can drop a pellet into a jug. They can throw a ball by 18 months. And they perform purposeful action because they want to see the result. You'll see when you do your Denver developmental screens that they'll scribble to see the picture because they know that there is some outcome. And also, toddlers are capable of building a tower of blocks. Here's the typical toddling gait. Gives them the name. Erickson in this time of social development for psychosocial development for toddlers, they are developing a sense of autonomy. So it's autonomy versus shame and doubt. A lot of negativism. No is the answer to everything. Ritualization provides a sense of comfort. Hospitalization will interrupt the rituals, and so that can be very frustrating for the toddler, and difficult for the parents when they try to get them back on schedule and back with their rituals so that life is good and everybody's not frustrated. They learn to tolerate frustration and learn acceptable ways to act in the environment. A lot of that happens through play. It happens through parents modeling what their behavior should be, and the child learns to tolerate delayed gratification during this time. And if you subscribe to Freud, this is a super ego and conscious is developing as they incorporate morals of society and acculturation. Kohlberg is another one that is in our textbook, who was one of the first pioneers to talk about moral development in children. Piaget, the sensory motor preoperational phase, age 13 to 18 months. The child uses experimentation to achieve previously unattainable goals. They're aware of causal relationship between two events, like you flip on the light switch and the lights will come on. Learn spatial relationships. They can put a small box inside of a larger box, and they'll look for items put away in the cabinet. So you have to hide things in higher places, then they climb. So things need to be locked away, and maybe don't let baby see where you're putting things away because they may go try to look for them. They will imitate behaviors and displays deeper meaning and understanding of what's happening in their world. Things they've seen on television, things that they've seen. They start talking about those sort of things as they can, in their amount of language that they have to describe what's going on. They will domestic mimicry. If you watch kids playing, you'll see that they're doing the same things that their mom and dads are doing in the home. Their concept of time, though, is still very embryonic, and they have a limited idea about timing in relation to time and memory and the ability to wait. So telling a child, you have to wait 5 minutes, or you have to wait until daddy gets home, those sort of things don't have a big impact on toddlers. This is, a child that's imitating the role behavior that's similar to the parent of the same sex. And they will just do, they will do whatever they see parents doing, clean up the floors, clean up. He looks very fascinated by what apparently his dad is doing there. And then the preoperational phase begins about age 2 to 4, where problem solving is based on their perception of an event. And then they have a transition between self-satisfying behavior and socialized relationships. The preconceptual phase is a subdivision of preoperational and preoperational thought. Implies that kids cannot think in terms of operations. What's going to happen next. They're very egocentric. They have the inability to, really envision situations from a perspective other than their own. So you can't really moralize when you're telling a toddler that they'll hurt someone. You just state, do not hit your brother. And it's more of a global organization, reasoning that changing a bed at any any part affects the whole. So if the bed is rearranged in the room, you may need to introduce the kids slowly because they think something's wrong because the room's been changed around. So it's just part of the type of where they're developing their cognitive abilities. Spiritual routines can be very comforting to a child if they learn through rituals like folding their hands for prayer. And religious teachings and moral development definitely influence toddler behavior. So, if the child has been introduced to formal religious teachings, then that needs to continue to be included as part of hospitalization and part of illness. You always refer to body parts by name. You want to avoid negative labels about physical appearance, like parents will say, oh, they have a big nose like their father or something like that, and kids think that there's something wrong with them then, so they begin to pick up on everything that they hear said. And so by the time that a child is 2 years old, they begin to recognize that there's boys and that there's girls. And they really do not like to be examined. You're going to find that out when you go into clinical, that they find that as an invasion of personal space. Sometimes they'll allow it, sometimes they will not allow it. A lot of times the parents have to be holding them for it to be a cooperative result. And then the development of gender identity, exploration of the genitalia is common, as they, learn that difference between boys and girls. And gender roles are understood by toddler. They may, just assume the type of roles that they see their parents doing. If the father does all the housework, then they would, might imitate that. If the mother does all of it, then the girls, might imitate that. So it's just kind of, that's one of the things that happens with gender development and their identity. And they like to play house, and that helps with the gender development too, or that is part of it. That's how we learn about our world as a toddler. Social development, differentiation of self from mother and significant others becomes more distinct, more than just, the object permanence. With separation, they have a better understanding of object permanence and some ability to withstand delayed gratification, but you can't expect a lot of that from a toddler. They have individualization. The toddler is able to wander away from the parents a little bit, and it helps when the child sees the parents are still in the home, and after they go to bed, they get up in the morning. So that helps them, be able to establish that trust. So like a child in the hospital, that's the first place they're going to look when they wake up. They're going to look over at the cot where the mom or the chair, where the parent is sitting, and make sure that someone is still there with them. And if not, they may get a little excited. Rapprochement, child will move away from the mother, but then they come back to her for reassurance. It's very characteristic of the toddler. They'll go across the room, like if you're in a pediatrician's office and you're watching this, they'll go across the room, then they'll come back, run and hide their head, maybe even in the lap of the parents or whatever. And they love their security objects, and so that is very also very important when a child is in the hospital. There's one. And you will even see big kids in the hospital, like, 16 years old, who have their security object still and have kept it around. But generally, it's, it's smaller kids. But bigger kids can too. So, don't be surprised. And, it's not a bad thing. Increasing level of comprehension. They may use gestures to communicate, to point to things and indicate, and then increasing ability to understand what the parents are saying. The comprehension is much greater than the number of words a toddler can say, so you have to be kind of really careful what you say around a toddler. And by age 1, they use 1-word sentences, and by age 2, they're using 2-word sentences. Toddlers develop the skills of independence, and these skills may, at first, till they learn how to adapt those, may result in really a strong-willed, volatile kind of behaviors until the parents help set limits and help the child to understand when is it appropriate to when that delayed gratification and how to be social around other people. Skills include feeding, playing, dressing, and undressing self. By 15 months, the kids should be able to feed themselves and drink from a cup and help with dressing. By 3, they should be able to help set the table and eat well with the family. By 18 months, a child can remove gloves, pull over shirt, and unzip their clothes. And by age 2, most remove an article of clothing and put on socks, shoes, and pants without, they may not get the right and left correct, but they will, be able to do that. And they begin to acknowledge the feelings of others, that, mommy's sad or mommy doesn't feel good. And, our brother's sad, brother doesn't feel good. There are some kids playing dress up. This is a really fun game for toddlers and preschool kids. Play. This is kids' work, and they magnify physical and psychosocial development in this way, and their interaction with others, becomes a lot more important. And they practice what is called parallel play. It means that they will play alongside other kids, but not necessarily with them. And they are having, emerging linguistic abilities. Their language is developing. They like to do things, make things with tactile play. And a selection of appropriate toys for this age would be dolls, furniture, cooking utensils, dishes, clay, that tactile play, trucks, push toys, very kinetically into socialization, writing toys, crayons, chalk, and finger paints, and those sort of things. And this is something you'll identify for your developmental project in your PowerPoints that you do. But you got to monitor and police toys, for small kids. We talked about that with safety. Safety is big in peds. All right, toilet training. You want to make sure that the child is ready, or you will get no cooperation whatsoever. Sibling rivalry. It's good to spend time, with the toddler if there's a new baby in the home, or it's good to have equal time for parents to have equal time. It's something you can teach, with each child, and it'll cut down on temper tantrums and negative behavior. And because if you're not paying attention to a toddler, they will go their own way, and it may not be good. It may be that they're developing some really negative habits. Negativism, they've got to learn that self-control. They've got to learn to turn that no into a yes. And with any during a crisis like a hospitalization, or the hospitalization or illness of another child or the parent, you really don't want to try to attempt new skills like toilet training. If you've got a brand new baby, you might want to wait a couple of months till things settle down a little bit. And kids will regress. Even older kids will regress during the time of crisis. So that's just something to remember. You want to minimize sibling rivalry, include the toddler during all caregiving activities, like with a new baby. It's a good tip. And let's see, readiness for toilet training. When a child begins to have voluntary sphincter control, like they're staying dry at night, then that is a good time to kind of predict that they might be ready for toilet training. They're able to stay dry for a couple of hours at a time. They have the fine motor skills to remove their clothing, and they have the willingness to please their parents, and begin to have curiosity about adults or siblings' toilet habits. Or sometimes they'll go take their diapers off. They get impatient with wet or soiled diapers, and you're starting to see some of these other signs, and so it's a good time to start toilet training. And there is the front way sitting and the backwards fashion. Nutrition, phenomenon of physiologic anorexia. You want to give the same dish and the same cup. Remember, I said they like ritual, and do not mix foods. Dietary guideline, obesity. To prevent obesity, the recommendation is, and this is an important concept, 1 tablespoon of solid food per year. So a 2-year-old, it would be like if you were going to give them a serving of squash, which they would probably really hate, you would give them, a 2-year-old, you'd give them 2 tablespoons of that, as a serving. And you want to make sure toddlers continue to drink milk, low fat, but do not feed a toddler a low fat diet. Low fat milk, but not a low fat diet. Good foods to feed kids are cheese, yogurt, green leafy vegetables, iron fortified cereals. They should have iron fortified cereals up to age 18 months. Fish and beans, vitamin C through 100% fruit juice in small amounts. If the child is drinking milk, that you can replace like 1 serving of their milk per day with meals with juice. And other than that, and that's like 4 ounces of juice. So kids shouldn't be drinking juice in sippy cups all day long, etc. Sleep activity, they'll sleep about 12 hours a day. They may not take one nap until age 3. Difficulty of going to bed are results of fears that must be remedied. Rituals are helpful. If you have to look under the bed for the monster, or those sort of things, it's just that's probably easier to do than trying to explain that there's not a monster. Dental health, by this age they have many of their primary teeth in, and they need to have regular dental examinations, and possibly even removal of plaque. Fluoride and low sticky sugary food diet. Young children can participate in toothbrushing, but the parents need to brush their teeth thoroughly. This is how you would hold a child to brush their teeth, and the most effective cleaning is done by the parents. You let them do some, because they'll want to do things their way, and they're going to certainly want to try that. But then you have to say, let mommy see, or let me try that first, or something, or play a game. I see something in there, or whatever. Nursing caries. These are kids that have a kid that has a very bad dental disease. Prevention. Remember, safety is key with pediatrics. Motor vehicle injuries is the most common injury after age 1. So car seat safety is so important, as well as the proper car seats. Drowning, again, the same as for an infant. Burns caused by pulling the crock pot off of the counter, climbing, going down into holes, opening drawers and trying to climb. Poisoning. Plants are something that you can look out for that might be poisonous you wouldn't think of, and they would think it was something to eat because you're encouraging them to eat green leafy vegetables. Window guardrails, gates, avoid walkers are dangerous. Aspiration and suffocation of the blind cords, the foods, the toys. Pets, they may have a nice stuffed puppy and they want to go pet the neighbor's dog, and that's not necessarily the right thing to do, because you never know how animals are going to respond to small children. Stranger safety. And then anticipatory guidance, the regular things. Do not run with scissors that your parents said. And you want them to avoid hard candies, and put decals on glass doors so the kids don't run through the doors. And here are some convertible car seats. Remember, they're backwards up until 20 pounds, but once they're 20 pounds, and the kids probably weigh about 30 by the time they get up to 3 years old. And then it's important for parents and grandparents to learn how to secure the locking clip on. And let's see. There's another car seat, and there it shows the latch with the flexible 2-point attachment with the top tether, and they're changing these all the time, so it's real important to go by the manufacturer's directions. Car seats can be obtained from the health department if parents do not have the proper car seats, can't afford to get them. They deliver them by the truckload to the health departments every day. Special plastic caps. You just really have to supervise kids at all times, because you can see this child probably knows how to remove those. And that's the end. Thank you.